Good morning. I would like to call to order the Public Health and Community Service Committee meeting on February 1st, 2024 at 8:30. Kathy, can I get a roll call, please?
Hendricks. Ness. Shorten.
Here.
Van Hoff.
Here.
Wagner.
Here.
Althoff.
Here.
Von Bergen.
Here. Can I get a motion to let Member Althoff in, please?
A second.
Ms. Wagner, Mr. Shorten, all in favor?
Aye.
Opposed, motion carries.
Thank you.
Good morning. How's the weather down there? Do we have any public comments?
We have no public comments.
No public
Last
comment.
call. All right.
Comments. Okay, great. So moving on to member comments. Any member comments? All right. I'll just mention I attended the People in Need Forum as Ms. Wagner did, and it was great to see so many people in attendance, and learned a lot, met a lot of people.
I'll just go off on that. There were over 1,000 attendees, not including the people who were in the booths. So it was an amazing day.
That's great. Okay, no new business, so we will
approve the
move
minutes,
on to the routine consent agenda.
Minutes.
Oh, I'm sorry, minutes. Can I get a motion to approve the minutes as presented?
I'll make that motion.
Ms. Van Hoff? Mr. Shorten? All those in favor?
Aye.
Those against? Motion carries. Okay. Now the routine consent agenda. Are there any items anyone would like removed?
As much as I support them, I have to abstain from 6.2, 6.3, and 6.4.
6-5, please.
6.5. Okay. Then can I get a motion to approve 6.1?
I'll make that motion. Second.
All right. Mr. Shorten, Ms. Van Hoff. Can I get a roll call, please?
Althoff.
Yes.
Wagner.
Yes.
Van Hoff.
Yes.
Shorten.
Yes.
Von Bergen.
Yes. Okay. So 2, 3, 4, you need to abstain? Okay. Any discussion on that other than that? Okay, seeing none, can I get a roll call for 6.2, 6.3, and 6.4?
We need to make a motion.
I'll make a motion, please. Mr. Shorten,
Can I second or?
I'll second.
Ms. Van Hoff will second. Now our roll call.
Here she is.
Van Hoff.
Yes.
Shorten.
Yes.
Wagner.
Yeah.
Althoff.
Abstain.
Noted. Althoff. Von Bergen.
Yes. Okay, 6.5. Could I get a motion?
I'll make the motion.
I'll second.
All right, Ms. Althoff, Ms. Wagner, and Mr. Shorten.
I'd like to hear more about the project.
I think it's fair to say right now, and Melissa's going to join us here. I think we're really looking for approval of a concept at this point. Is that fair to say, Melissa? We aren't approving a project per se, but we are approving a vision or a concept that we'll put out on the street, and then we'll be bringing back hard contracts.
Right, so we have a general vision board, I guess, for making improvements and modifications to the Crystal Lake facility. Needs that were identified, through COVID, spacing of employees, having the ability to do some drive-through clinics, that kind of thing. So what this is what Peter said. It is that vision of the modifications and improvements we can make to that facility that are needed to space our employees out, make the lobbies safe. Accessing the bathrooms in some places are difficult. So this is just conceptually approving and earmarking these dollars, but we have an RFQ out for architects, so we have to hire an architect who can scope the project for us and narrow down those costs so we can get more specific. So then all those things, when there is a contract, those things are going to come before the county board for approval. But we can't really move forward to get those specifics until we conceptually approve the funding to move forward.
So, and I read through the information we're getting, which is, just talks about a general redesign, lighting changes in the parking lot, the drive-through vaccination clinic, but we don't, because the way that I read this, we're authorizing appropriation towards a general idea.
But we can't provide the specifics and the exact costs until we retain the necessary professionals who can give us that information. Then, so we wouldn't be actually spending any money till we bring, once an architect is identified, because right now there's an RFQ out there to identify architects who can then scope the project better.
Okay.
Then we would be coming back with specifics. But if, I'm not sure if there was another order we could have done this, but this was, in discussions with facilities. We've been working closely with them to move this project forward.
Okay.
Oh, Pam has her hand up.
Go ahead, Pam.
Thanks. Just so you understand, you're not going to go on that contract to invest a huge amount of money that's been allocated. We still have the ability to approve and go forward. Also, any gone to the tours that were being given, I talked about at that time with that older building.
I can rephrase what
Yeah.
she's saying.
Okay.
Yeah, she
So
basically
you're really
said the
breaking
same
up,
thing
Pam.
Melissa said.
I'm a good lip reader, but-
So what she's saying is you can't, first of all, this is ARPA money that we've set aside, right? Didn't we set-
Correct.
We set aside
Right.
7 million for.
Right, so this is part of
Yeah.
that entire set aside.
So, yeah, and I don't know if anybody has toured the Crystal Lake Health Department, but it needs big revamping. So yes, that's exactly what she was saying. There's a lot of deficiencies there because of the way it's set up.
I have toured the facility, and it is in need of just many things. So I see the need there. I guess I would have just liked to have seen a little bit more detail beforehand. I mean, it's $2.5 million, and I'm having a hard time sitting here looking to a.
We have, so we can
money.
provide, so the RFQ, I didn't include that, but I can certainly add that in and, as this moves forward if it moves forward to finance an audit. But this basically lays out, and again, we worked with facilities on this to lay out, we need to reconfigure the public entrance, reconfigure waiting areas, right? So we've sort of set up the things that we're looking for feedback on for an architect to do for us. So if that would be helpful, we can certainly provide that.
Yeah, I'm having a hard time with, I don't object to the general concept that it needs to be, work needs to be done there, but $2.5 million seems like a lot of money. And
So-
without,
I think we need to be clear that we will have likely several contracts that come back to eventually spend that $2.5 million. This is sort of okaying a concept to go get the RFQ on the street. So if you are uncomfortable with elements of this expenditure, there will be a second opportunity to say no.
So more information's
Sure.
gonna come down the pike that will inform
Yes.
whether we move, because this is a development phase.
Well,
This
We may
is,
not be able to accomplish everything that's in that RFQ with
Right.
$2.5 million.
And we may have to make
Yeah.
decisions to narrow the scope of the project.
yeah,
But without an architect to give us that information, we also can't move forward.
right.
How much would the architect cost, just to get the,
We don't have those costs yet. We're just looking at a request for qualifications at this point.
so is there like any sort of urgency that we allocate the 2.5 million in ARPA today versus could we just consider this once we do have a little more information?
So the timeline, I mean, there already is a timeline and schedule to try to move this forward, because as I understand it, from facilities, you know, it takes a long time from concept to execution. So like, there's not gonna be any changes probably until the fall, right? So we're just like setting it up, the planning phases, so that we can bring the information back and have you approve each
So-
segment of the project.
Maybe that's a really good question, though. We aren't really letting go of $2.5 million today. We are
Correct.
saying, go get a quote for an architect, and we'll bring you that contract next. That's probably gonna be $100,000,
Easily,
right?
easily.
This is just setting aside the money, the ARPA money that was already designated to the health department
Yes.
for this.
It's already been designated, John.
Yeah, when we got our ARPA, the 28 million or 29 million, we set aside 7 million for the health department for changes and programs that they were gonna have.
And then we bring each project before the committees and the board as they develop or become concrete. And so that is what we have done. This is similar, right? But this project is different in that we can't just say, okay, we need a staff person to do this thing. It requires a lot of components and that professional, architect and then a contractor at some point. So this, we're not even close to getting a contractor. We're just having somebody help us understand what all the possibilities are for what we have outlined.
Right, and I think the thing that the architect does is say, here's what you can do and here's what you can't do, because you don't have money to do it. So what's your priorities? You pick the ones that are the most important to you, because working with architects, they often, you say, give us your best quote, what can we do? And it often far exceeds the money that you have available, and you have to start scaling down. But you really can't know that until the architect walks through the building and creates and actually drafts architects draft what it will look like, where the work will occur. You can't hardly get there until you get the architect into the building.
And our current timeline to bring a resolution back for the architect would be the March meeting.
That sounds very reasonable.
So if we haven't had the architect, go through and do their thing at this point, do we have anything showing where this estimated to an
So we worked with facilities, to get those costs. I don't have the spreadsheet in front of me, but there's lots of,
But there is a spreadsheet.
of components of, what things would cost. But again, they are only estimates at this point, and that's where we have to further refine and scope the project so we know what each component is going to cost. But we, at this point, have only worked with facilities to develop those costs.
Could that be shared with the board?
Yeah,
So
It would've
when were the estimates created?
we've been working on this for quite some time. Over the last 6 months.
I guess not to interrupt member
Go right
Ness,
ahead, though.
but it would have been nice if we could have had that for the meeting.
We already said that.
Did we?
Yeah.
then I apologize, but
Yeah, so we can, I'll add the request for qualifications in so you can see what the scope is at this point to retain an architect. And then we can provide the spreadsheet with the estimations for the project.
I don't
A
want to
lot of it's
hold you
based on
back.
square footage, right? But again, it's just conceptual at this point, and until we get the details, I don't think we know. It's just an estimate at this point.
I don't want
Because we have to we have to, by the end of this year, right, we have to have designated the use of these funds. And so my understanding with the timeline and based on our conversations, it's almost gonna take us this entire year to get to that point, to bring back a specific resolution about these are the changes that are gonna happen to hit that 12/31 timeline for the ARPA expenditures.
Remember, we have to have all the ARPA
Right.
money spent by a certain time.
Right.
Otherwise it goes back.
Well, it has to be designated by this
Yes.
year and
Right.
spent by 2026.
Right.
And these changes are gonna take some time too, to actually, so maybe we won't even break ground until 2025. You know, none of that is determined at this point.
and would this resolution, would this satisfy designation at that point?
Yeah, it's already been through Bronner,
entire
yep.
amount.
So we don't bring anything before you until it's already been looked at by Bronner. So they've already looked at what we're proposing.
Any more questions?
So the 2.4 million is based off of going through and creating a, I guess, a punch list of things that you'd like to have done.
Yeah, and square footage, things like that.
Are you talking about expanding square footage?
Well, a drive-through clinic would potentially expand the square footage, but I think a lot of the changes are simply reworking the lobby areas and office space to spread people out more. And then the part of the exterior with the drive-through, we have an idea where it will go. But again, until an architect may say, you cannot do that.
And tell me, drive-through clinic, what's that about?
So we don't have the ability, if you recall, this allows us to better facilitate, in the event of emergency, people can drive through vaccinations versus having to find a place to stand up a clinic. So it creates better preparedness for us. We can also utilize it for rabies vaccination. We did that during the pandemic so people didn't have to get out of the car, so we can be more efficient about how we deliver our services.
How much of this proposal is that mobile clinic you referenced?
It's not a mobile clinic.
Okay,
No,
sorry.
it's dry.
Yeah.
Yeah.
It's
Yeah, let's
you would
go
come
there.
on site and drive through, so it would be partially or fully enclosed where you could drive through. So you're not exposed to the elements.
So at 2.4, roughly, what is that?
I don't know that we have it separated exactly like that. Ann, do you know off the top of your head? Again, we'll get you we can break down those costs that we have thus far. But again, a lot of this is based on what we think that square footage change is going to be, putting in doors, taking out walls, that kind of a thing.
Yeah, so those.
And again, these are not this is not my area of expertise at all. That's why we've been working with facilities to try to get those estimations. But I think they would underscore they are just that.
It's just hard for me to vote for something without having more detail on it. And I'm not saying I'm opposed to it, but I would like to be able to review this before I vote to not allocate $2.5 million to a project.
Well, if I understand Kelly, it's already been allocated. So we're not
So
voting.
then what's the
to
point of
allocate.
this vote?
Well,
To move forward.
To move the project
forward and
forward.
get some estimates
Pete-
from.
Peter, Scott, can you provide clarity on this? Is this money already spent, or what are we doing here with this vote?
It is not spent. And I think again, I'll go back to where I was a while ago. I think what we're really doing is saying we're generally approving this concept. We have a $2.5 million project as part of our $7.5 million set aside, and we need to get an architect hired. And as a county board, you're okay with getting an architect hired. That's really what we're approving today.
And I would
You're
add-
going to, and if there are later decisions that about construction within the animal control facility and the health department in Crystal Lake, there will be later decisions to be made about, and you'll have an opportunity to exercise your opinion on whether or not those expenditures are appropriate.
And I'll just add, so of that $7.5 million set aside for the health department through ARPA, this is taking $2.5 million of that and is specifying it for this project. So all you're doing is now you're just even putting it into another bucket generally for this project, so as other projects come through, they won't have access to this money. You're basically earmarking it further. And then once the contracts come in, it's all based on estimates. Once the contracts come in, the bids come in, we'll know what the costs are. But this basically just reserves that budget in ARPA for this project, and that's what we're doing.
And out of that 7 million set aside, that's something exclusive to that health department.
That's correct.
They can't be used on any other projects. It's got to be in that domain.
Yeah, that was when ARPA came in. And he can elaborate. You put a fence around.
That was it was the earlier decision that 7.5 million of the 30 million that we were keeping for county functions would go to the health department. Now, could it be undone? I suppose it could, but that was the previous decision. That's the decision that we as staff have been operating with for, a couple of years now.
Yeah, and that was appropriate in light of COVID, and those funds would be designated to the health department because that would, you would have a lot of expenses that you would not normally have during COVID. It was a game changer for driving through, getting vaccinations, and not having to go inside the site. So, yeah, that's great in my opinion.
So if we approve this resolution, 2.4 million, that starts the ball rolling. We have an architect that comes in with a design, and then the board takes a look at the design and says, okay, if you're saying the architect's going to take 100,000, 2.35 million of that's left, come back with the design, and we say, okay, these 4 punch list items we're okay with. These other 7, which make up, say, $1 million, we're not. Can we then pull this money back for another project, whether it's with the health department or, if Pete said, if we want to reallocate it to somewhere else?
Yeah, so you're just reserving their ARPA allocation specifically for this project. And whatever's not spent, if it comes in far less, then you can make a decision on how to appropriate those dollars elsewhere, whether it's for health department or for other purposes. But it was originally, the intent was this money would be designated to the health department. So, that would be obviously a policy decision. As Kelly pointed out, though, time is of the essence to allocate these dollars. You can get them spent before you lose them. But just to be clear, the $2.5 million allocation, like you said, you have 7.5 for the health department, and then you're further reserving of the health department's money for this project without spending a dime, because those contracts would need to come before you, because they're going to be over $30,000 for the architect, for the construction. So you're going to have the opportunity then to review once the bids come in or once the architectural proposal comes in to approve those. So you'll see that along the way. So this isn't, okaying the project start to finish. So all you're doing is approving the concept and then further reserving dollars or reserving a budget for that. Now that budget will be further developed as we design the project, as we know what those costs are, not just estimates. So you still have many more opportunities to really see this development and work through.
When was this, the $7.5 million, when was it allocated to the Department of Health?
Early on when the ARPA funding came in, Pete, maybe you can elaborate.
Might be 2021.
2021 when ARPA was passed with the CARES Act.
Yeah,
Watch this.
I think that generally it was done in about the summer of 21.
That's when the money, yeah.
That's when we got the 60 million or almost 60 million and
And
said
so I'm
half is
gonna,
gonna go to the community and then half will stay with us. And then we said 7 million of the half will go to the health department.
I'm,
Yes.
and I'm going to make an assumption that the board members at that time were careful and thoughtful about how they broke up that ARPA money so that they could fund pressing capital issues that the county was facing. And so looking at building deterioration is not new. We had this conversation about the clerk's office a couple of weeks ago, deferring the work of assuring that we can grow responsibly as the county grows. I'm assuming that that was some of the thinking, that we hold some of that money. And so I have been to the site and it is underwhelming. It's underwhelming, and I don't know that I was in a wheelchair, I don't know that I could navigate that site well. It's not ADA accessible, and I'm surprised somebody hasn't filed a complaint against your accessibility issues over there, which are significant.
well,
So I'm just saying, upgrading ADA is expensive, which is why buildings do little piecemeal and not actually make the whole thing ADA accessible. So I couldn't get in the front door.
And when we had this resolution, we had a resolution and the 7 million was designated toward the health department. So we had spirited and healthy conversations about where we were gonna spend this money in 2021.
Yeah, but respectfully, it was a different board at that time, and also the reasoning in the resolution itself, it's all tied to COVID. It's 6-foot distances, it's not having spaces for large vaccinations, it's animals being given up because of a pandemic. These are largely not issues anymore.
I would disagree with you, but I will say this. If I'm challenged, if I've challenged mobility and I can't navigate a health department site because I can't get my chair around, that to me, how does that work?
Our building's not ADA compliant?
No, they're not. It's not, it's minimally. But for me to walk around like you walk around, for me to roll around like you walk around, you can't do it. It's expensive.
Go tour the Crystal Lake facility.
It's not horrible. It's just, if you don't live in a chair, you don't get it. Sorry. Sorry.
Right. I'm gonna temper that. Buildings are accessible. They can certainly benefit from improvement and from updating. But I would say our facilities are accessible. We're not, we're not out of compliance.
I think you should live in a chair. I do. I think you should live in a chair.
Is there anything stopping us? Can we do the RFP without voting on this today? If we tabled this, or do we have to approve this in order to put out an RFP?
So all the resolution is doing is basically giving the blessing and reserving that $2.5 million budget.
No, I understand, but if they were talking about an RFP for an architect, can we put that RFP out? There is an RFP out, correct?
It's just
RFQ.
request for
RFQ.
qualifications at this point.
And that's already out, correct?
Yes.
So it's already underway.
I would like to consider this further at the next meeting. I would make a motion to table.
Pam wants to say something.
I'll second.
Why don't we, okay, so there's a motion on the table out there to table this
Can we table?
until.
To the next public health committee meeting.
It's not a postpone.
Right, you can't table.
I amend it to postpone
Thank
the
you.
next public health committee.
Okay, seconded by Mr. Shorten.
I'll just make the comment that we're under time. If we do not allocate this money by the end of the year, we lose it back to the federal government.
And I appreciate that, but it's a little bit frustrating that the $7.5 million was allocated in 2021, and we're in 2024, and all of a sudden we're under the gun. Because if these improvements were necessary, what's taken place in the past couple of years?
I think it's more, so we have continuously been bringing projects. It's just sort of spacing, timing. Some of this stuff takes time, then other priorities come up. So it's not that this hasn't been a priority. We have been talking about it probably for well over a year. It's just getting to the point, and there's other things coming through, working with Bronner. You know, all of that does take time to kind of hone and refine what we're looking at. Could we have brought this first? I mean, this has been on the table from the beginning. This is not like a new project. It's just we've done other things up to this point, and now it's like, okay, now we have the time and the ability to move this forward, and so that's why we're bringing it now. But it's not like this is a new idea. We
So-
have been talking about it for years.
Is this the first project coming out of that 7.5?
Oh, no,
I mean,
this is
how
close
much-
to
how much do we
almost the
have
last
left?
project.
Yeah.
How-
There's one more.
This is the last.
This
Well,
is what's
there is
left?
one more. There is
Or-
there is one more project that is going to come next month.
The grant project.
So how much do we have left of what they've
Oh,
already
then
been
almost, so
allocated?
if this project and, no, there is a mobile clinic project being proposed. So you will see that next month. So that project and this project, the MAP projects have, again, you did sort of conceptually approve those. So this is similar in that case because you approved the money, which was over $1 million, to earmark to these MAP projects. Sorry, when I say MAP, I mean they're going to be community projects. MAP is what we call our community health improvement planning projects, right? Where we work with the community, it's tied back to our community health assessment. Those projects individually are gonna come before you, but we fenced off those dollars for those projects so that we can put out to the community, we have X amount of money, they're going to apply for those dollars, then each project, kind of like how you did the community, help me out, McHenry, what were the community projects called?
Advanced
Advanced McHenry County, so same concept.
It's a mini Advanced McHenry.
Yeah, it's a mini Advanced McHenry County. Those projects individually are going to come before you. Bronner has approved them globally, but until we hear from each individual applicant and narrow down and select those will go back to Bronner to look at them individually, and then they're going to come here in the form of a resolution for each of those projects for you to look at and approve. So this is similar to that, and then after these two projects, we have earmarked all those dollars. And we were tasked to earmark them before 2024.
At Finance Committee next Thursday, there'll be an update on the balance of all the advanced McHenry County projects. That Chairman Scal has asked for that, and Carrie Wise and Carrie Johnson will be doing that.
Ms. Altoff.
Feedback. We have discussed these projects at this committee members previously.
Okay, we still have the motion out there to postpone.
Can I call a question on that?
Yeah, let's take a roll call for postponing.
So motion second on the table to postpone to the next public health meeting. Van Hoff,
No.
Shorten,
Yes.
Ness,
No.
Wagner,
No.
Hendricks,
Yes.
Altoff,
No,
Von Bergen.
No.
So now we have the original motion and second on the floor to approve.
Can we call the
I
question on
think
that?
we will, yeah, I think we've discussed this enough. So can I get a roll call for that, please?
Could you
Wagner.
please restate what we're,
It's a motion to approve the resolution as presented.
Yes.
Van Hoff, Shorten,
No.
Altough,
Yes.
Von Bergen,
Yes.
Kelly.
Oh, I was first.
Oh, you were.
In a world where we're always last
I know.
on the list.
I used to be first today, before I was married.
Moving forward, is it possible to
No, we're gonna
kind of
get
have
details.
a running tabulation
Well, that,
as things?
that spreadsheet, I believe, has been circulated and presented on multiple occasions, and this was in there. So I'm happy to provide that again so that you can see all the projects listed out. We will also include, I'll follow up with Kathy, and we'll get you the RFQ, and then the specific, more details specifically about the estimated cost for the improvements related to, specific to this project.
Thank you.
Yep.
Okay, next up, presentations. We have Jake Roan and Jeff Pointer from the Workforce Network.
Good morning.
Good morning. Hey, Kelly, we're in Illinois, you can vote twice.
So today we're going to be going over our four-year local workforce development plan. I'm going to kind of give a breakdown of what it is so you have a good understanding of it. And this is a plan that, as the name says, we have to do every 4 years. So what is the plan? This is something is required under our act, the Workforce Innovation Opportunity Act. It establishes 3 different plans within the state. So there's a state plan, a regional plan, and a local plan. So we are responsible for our local plan. Me and Jeff will work on that. We put that out. Our regional plan, we are, it follows more the economic development area for number 4, I believe, where all of the local workforce areas work together to develop that plan. Then the state takes on and develops the state plan. With that, this year, the kind of consensus was not to rewrite the plan in totality, but there was just updating to the plan and some themes that were involved. So the themes that the state focused on was equity and access and service integration. So understanding the planning process, and this can be a little confusing, is we're all planning at the same time. So the state is planning while the regional is planning while the local is planning. You would think it would trickle down, but they don't quite do it that way. So with that, the state produces a guideline for us. And we have a good understanding of what their plan is going to be, and then we fit that within the regional side and then fit that within the local side. So in essence, they are providing understanding, but all the plans are coming out at the exact same time. So the state plan doesn't get published before the regional and before the local. It's all published in March at the same time. So going through the sections of our local plan, and I'll just give an understanding of what is really involved. So the introduction and area description. So this is a lot of our labor market information. Understanding what is McHenry County and what are we comprised of. Where are the industries? So this also involves getting input from local businesses to understand what is the needs, what kind of economics just in general we have. The regional component, and this is just taking more or less our regional plan and referencing back to that. So the first 3 chapters are more or less just a reference straight back to the regional plan. And that regional plan is really established to understand what is the need for the region. So understanding business and initiatives, different directions. For instance, the last plan had a lot in the transportation and distribution area. So that was a focus that regionally we did some efforts and initiatives towards. The next one, chapter 4, is on operating systems and policies. So this is very much how we run the program as a local workforce area. So we'll have, and go into this later, and Jeff will talk on it, all of our local policies on there, but also how are we interacting with the public. The next is performance goals and evaluation. So this is, all of our performance goals are negotiated with the state. So basically, this is putting those performance goals into the plan that were negotiated. And then just understanding that, so every 2 years we're negotiating those. So every 2 years we also update this plan with the new performance goals. And then chapter 6 is the technical requirements and assurances. So this is how we're going to fiscally run the program to make sure it's fiscally sound, and also any compliance things. So making sure we're following ADA requirements, so on and so forth. And then we have our attachments, which I'm going to be going into the service integration self-assessment in more detail in the next slide. Our service policies, so those are part of chapter 4, understanding how we run our program and what are the guidelines, and then any other agreement. So next we're going to get into service integration. So this has been a hot topic for the state for a long time, and for a just reason. We want to make sure that we are integrating our services with our local partners. And to understand our local partners, they are, for instance, Department of Employment Security. They are Department of Human Services, also the Division of Rehabilitation Services. They are the Housing Authority, Job Corps, a senior employment program, and McHenry County College. So those are our partners that we're all together in this workforce system. So we want to make sure we're not overlapping. So this is what really what part of service integration is. So what we did in December, we came together to fill out this self-assessment. Now, if anyone ever wants to see the self-assessment, it will be part of the plan, but I can get it to individuals as well. But it's about a 50-page document that we had to sit down for about 4 hours with 8 different organizations to make sure we're all feeling the same way on how we're presenting our services. Really, and I think the biggest thing we got from our meeting in December was the fact that we all feel very much that we are integrated. We are as integrated as we can be within what our abilities are. So going through some highlights of this, and really some big things that came as tactics that we use. We have a partner referral form. So this partner referral form allows us to directly refer customers that any of the partners get to any of the other partners. So it's a great system, and we track that to make sure we're closing the loop. So if there's any issues where one partner refers one to another and they don't follow up, we can immediately address that and know, okay, that person was referred on so-and-so time, let's get them the services they need. It really has created a faster ability for us to make sure we're connecting the services together. We're also holding bi-monthly partner meetings. So these partner meetings are held right after our board meetings, and it really gives a time for all the partners to come together, have conversations, and making sure we're addressing the needs. So if there is issues potentially in our one-stop center, that we're addressing that. If anything comes up where there could be issues with the partner referral form, something's not working, we're having conversations. And having those every other month really gives us an avenue. So we're not taking 6 months to get things addressed. We're addressing them as they come up. We're also holding frequent partner trainings, and what's great is we're recording these trainings. So we've established a library of trainings that if anyone new comes in on any of these organizations, they'll have access to go review these trainings again. So then someone who starts, say, at DHS and needs to understand what our services are within the McHenry County Workforce Network, they can easily go do that. And those videos are nice. They're short. They can be anywhere between 30 minutes to an hour. So just a great avenue for training. Then also, one of the big things that we really see is we have effective communication between partners. I can't say enough that our team, Jeff's team and the career planners, they will reach out to other partners and have conversations if need be. There's partners coming in all the time. We have the senior employment program that comes in. We have staff from McHenry County College as part of our resource room. We have staff in Department of Employment Security as part of our resource room. So we're all talking together, making sure everything's being coordinated. Then going into some challenges that we did identify is there are limitations due to technology and just organizational barriers. Just with having 8 different organizations, it's hard for us to say, oh, we can just use one system when our systems are dictated from the state. So those are some barriers, but I think we've done a really good job of getting around that and communicating in an effective manner that we're functioning very well. And those are things that, again, are out of our control, but we adapt to it.
With this new plan update, our 4-year revision to the plan, Chapter 4 included some additional policies that need to be inserted at the local level. While we have always had a library of policies available from the state and follow those guidelines, there are some policies that the board acts on regularly. Such as income guidelines when the Department of Human Services sends out new self-sufficiency guidelines and how we will incorporate those in for priority of service and self-sufficiency. As the cost of training goes up and down, we address the amount of funds set aside for each individual to use in a scholarship fund, the individual training account. Support services such as how much money will we help them with if they need help, transportation, childcare. To start training, they might need, if they're in a welding program, they might need to get steel-toe boots, things of those natures. On the youth side, there are incentives and stipends for milestones that they accomplish along the way. With the GED testing, there's 4 accomplishments before they can sit down and take their GED test. So there's things like that. The workforce board is required to go out regularly to look at the programs and potentially procure programs for the youth and adult programming. One of them that you're pretty familiar with is the Project Search with Parents Alliance in helping young individuals with disabilities learn the workforce skills and hopefully procure self-sufficient wages in an unsubsidized employment. So I actually have some success stories I'll hand out at the end that Shannon from Parents Alliance provided for our board at the last meeting. So new to it is a training provider list that we need to actually incorporate into our local plan and policies. But this is looking at training providers and the programs that they're putting forward to us. Do they meet the needs of the local economy? And are they providing enough education and employment opportunities upon completion of those? So while all of these policies have been in the state repertoire, they've asked us to include more at the local level. And many of those are just references back to the state plan, the state policy. It's quite a library that they have. But they've actually asked us so that we have it in hand in front of us, the career planning policy, selective service registration. So any male born after January 1st, 1961 needs to be selective service registered. If they are not, then we have to go back to the selective service and find out why and with them, so. And it really depends on a number of things. You know, they've asked us, while we've always had eligibility requirements that are dictated at the state WIOA policy portal, they've asked us to include those in our area. Many times some of those issues are addressed in the changes would be addressed in the self-sufficiency guidelines and priority of service. And again, adding to it that eligible training program list. With that, we actually took the opportunity to reorganize our library. Before it was just added to and added to, the next one was added to the end, but now we group them. So eligibility policies are grouped together at the beginning, then the income guidelines, and then the training opportunities such as scholarships to McHenry County College or First Institute or a technical school, internships, on-the-job training and income worker training opportunities. Then the support services to make sure that they're successful in completing their training and entering the workforce. So, and GED. So, and then the procurement of policies such as the young adult program. We've added a complaint policy to express to our staff the importance of taking complaints seriously and acting on them in a timely fashion and giving feedback to both staff and the customer who has concern. So, and hopefully be able to resolve those. So, the policies have always been in place. They've been reorganized, they've been added to. Many of them, the policies will have the title, and then it will actually reference the WIOA, the state WIOA policy chapter and section. So these will be added to the list, the updated policy. So.
And if anyone wants a complete list, that's going to be part of the presentation. You can look at it, but it's also going to be on the local plan as well. We're going to be going out for public comment with this local plan in February. So just please watch for emails coming out. I will send it to the entire board just to make sure everyone can have it, and please pass it on to others as well. So the more public comment we have, the more I can integrate and make sure we're addressing the needs of the community.
Does anybody have any questions?
Yeah, I just wanted to clarify. So we will all get a copy of the presentation that you just presented here?
Yeah, I gave it to.
It's in our email actually already.
Oh, it is, okay. And then the other thing is that, will the partners, you mentioned, did you say 8 partners?
Well, there's actually many more. The core partners total 8.
Will they be listed in that presentation anywhere?
I don't believe so, but I can get to you that.
That would be great, thank you.
Yep.
We have that directory from the partners that we can provide them. So in our partners meetings that we have, we put together a directory for each of us to use that tells us what the agency is and basically the core of their services so that we know that we're making an appropriate referral.
Yeah,
So
and just,
we can provide that.
just so I can have a clearer understanding.
It's not
of
as big
how
as
all
people
of
in
this
need
works,
directory, but
because you got a lot
but we
of
do
partners.
utilize people in need also, the directory.
I have to count them out when I think of all the partners, because you never want to miss one.
So if you had someone that needed to take a class in English as a second language, for instance, which they have at McHenry County College, could that be something that would be?
We would make a referral to adult education English.
And adult education is a partner.
Yes.
Okay,
So
cool.
we work directly with them. McHenry County College is actually split into 2 different partners. We have adult education and then Perkins, which is
Career technical education.
Yeah, career and technical education.
Okay.
And this morning, Tuesday and Thursday mornings, we host, the Workforce Center hosts GED program with McHenry County College. And generally, we have anywhere from 9 to 16 young adults there participating in that. They start at 9 and finish up 12:30.
In the GED program?
Yep. Yeah. That's just the class that we have. I mean, and they're all over the county.
That kind of comes under your area, right?
Yep.
Okay, all right, thank you.
Hey, Ms. Ness.
Longitudinally, do you follow people into the workforce for any period of time to see, do they stay anchored and employed? Are they able to, because I mean, I'm just thinking about like how we are talking about the network between employment and workforce housing and transportation and that ability to stabilize your employment. Because I'm going to make an assumption that their employment wages don't match the housing costs, just from what we're learning in the workforce group. So how do you do that?
When we negotiate performance, as Jake said, one of the factors that we negotiate on is wages. Wages at first quarter, second quarter, and fourth quarter after they exit our program. So we're following their wages during that program, that first year out. But we also provide follow-up services. So we reach out to make sure that they feel comfortable in their employment. Are they encountering issues? Is there something that we can assist with?
And that is one of the policies. There's a follow-up policy.
Yeah.
How long?
1 year.
1 year.
So at the end of that year, you don't.
They're still available to come back.
But you don't know because you don't track. I mean, it's not a criticism. You
No.
can't track it forever. But especially with young adults, I would think 1 year is a short time to.
In many cases, they don't get exited right at employment, so we have them for another 3 to 6 months. And then they have another year on top of that after their direct services have been completed, so.
And I would say for youth, it definitely a lot more just because of the dynamics there to making sure they're adjusting properly, everything is okay, because as we know,
When you
youth
say
like to
youth,
change.
what age are you talking?
Okay, so our populations in the youth program are anywhere from ages 16 to 24.
Okay.
And then the adult population starts at 18 and goes to whenever they decide
Oh.
to leave. So there is that overlap from 18 to 24. And when we look at that, how much experience do they have in the workforce? What are their understanding of the workforce? What skills do they have? You know, so we from that overlap, we try to determine where can we best serve them. So are they going to need a little bit more, or do they have an idea of a career trajectory, and can we just help them with attaining the technical skills rather than just the soft skills?
Okay, thank you.
I would advise anybody, if you're interested in this, go tour. So I'm the liaison, and I took a tour the first thing, and it's amazing, all the resources they have. And then you talk about your board. Your board has manufacturers, local business owners, people from MCC, trade unions and departments from the county. I mean, it is, and I'm sure there's others I'm missing, so they encompass all sorts of different jobs and careers in industries in the county, represented just on the board in their discussions.
Board composition is somewhat dictated by the legislation, the Workforce Innovation Opportunity Act. The board must be comprised of at least half plus one of business leaders who can make those hiring and firing and high-level decisions in their organizations. Then we must have economic development. We have to have organized labor. We have to have adult education, the TANF program, the Veteran Services, Trade Act, and Trade Act has been sunsetting, but it was big in the 70s and such, where a lot of employment was lost to overseas competition. It's unemployment, it is the IDES reemployment services, it is senior employment, it is Job Corps, in that. So there's a form that Jake fills out that I used to fill out that we have to keep a certain balance, because when you have one in this area, it might trigger that you need somebody else in another area. So it is, your board is what, at 24?
24 right now.
Yeah. When I took over back in 2010, we had 37 on the board.
Wow.
And trying to get quorum.
My goodness.
Wow.
So, but we still are meeting all the representations that we need. You know, we've got some really dedicated people that come to the table for us. So, Sandy Pierce, who owns Phoenix Woodworking, has been on the board for, well, since the 70s.
Oh my I know Sandy.
And one thing we do try to do is making sure the business side, so as Jeff said, was a half plus one, is representative of our community. So we do have, and McHenry County has a large manufacturing population. We have a large amount of manufacturers on the community. But we also have making sure we have healthcare on there. So we have Mercy and Northwestern Medicine on there. So we're trying, and I really try my best, especially when there does come a time where one board member drops off, that we're looking at that representation, that it's kind of understanding where we need to go. So if potentially there's an industry that isn't recognized yet, and we brought on Walgreens as a great understanding for the retail industry, then we're going to try to target that. So I'll work with our chair to understand, hey, these are a couple companies that I'm gonna reach out to, and then ultimately making sure that that's good and follows along with kind of what he's looking at. We do an orientation with them and then bring them on.
Quarterly, I do that workforce action that I distribute out to you, and on the other 2 months in that quarter, you get a postcard with a success story. I just want to bring this up, because we talked about the plan with the representative from Darren McClibb's office, and that was, she came to see us because of success stories that we send out. At the last board meeting, Project Search shared with us success stories from the 3 cohorts that have completed that. So she highlighted one individual from each of the graduating classes there. And these individuals have varying levels of developmental disability, but they are you know, in unsubsidized employment out in the community providing.
At some point, I would love for this committee or the whole board to see the video about Project Search. It's so inspiring.
And as we get closer to that graduation, which will take place in May at McHenry County College in the auditorium, we will make sure that everybody here is invited to come see the graduation. Just wanted to share those with you. They're always exciting.
So are these success stories on the website from past stories?
These have not been up on the website. The Workforce in Action does get posted up to the website.
Okay, so we can go back and look at some of the
Yeah.
past success stories?
Yeah.
Okay, cool.
So,
I also want to say that Jake and Jeff have been invaluable members of the workforce work group. Just provided us with such invaluable data and contributions. Thank you very much. It's been so good having you at the table.
well, thank you very much for all your support. We appreciate that. And as Kelly alluded to, you are welcome at any time to come over. I know that Mr. Shorten's come over. That you come through anytime. Any board member or anybody of the public that wants to learn more about what we do, please.
Great. Well, thank you.
Thank you.
Okay, reports. I have Diana Hartman, the regional Office of Education.
Hi, good morning. My old-fashioned teacher handout. I just wanted to come this morning and give an update on the Pearson Testing Center. If you could pass that back. Thank you. It's been 6 months of data now that we have that, so it's just a good time to talk about that. I would interpret the data and information as a success. So as you can see, our number of testers is over 100 typically. The first month we opened, we were just a little bit under 100, but we're kind of averaging. I didn't, pull an average, but somewhere in the 120s, but a lot of those months were above 130. So I think that's a lot of people in our county that are utilizing this. I've heard stories of, people that are coming home for a break or a vacation decide to take it here to obviously our residents as well. And the most of the tests that we do offer, the highest numbers are in the teacher evaluation system. So that's going to be anywhere from it could be a para to a teacher to an administrator taking the state licensing for that, and GED is the second highest test that we give. But we have, there's over 200 and some tests that we're able to give. And as you can see at the bottom, and I don't know all of the titles for some of those acronyms, but you can see there's a lot of different types of tests that we give. And I get excited when I see something like, oh, the Air Force officer test or a Secret Service and things like that. That when we're sitting here in the Midwest, that I'm not always thinking of, we have that here too. So just to see if you have any questions, comments, thoughts, but I wanted to really give you a 6-month data. The rent that we now pay back to the county is $1,240 per month. So the money that we make doesn't really cost a salary of the person. I have somebody that is paid for by my office, not the county. It's not a county position, that is under truancy, assistant truancy, that does the paperwork for truancy. They are actually digitizing all of our GED records this year as well, so we can get that all moved out of the office physically, and then they proctor the testing center as well. So I wanted to update you because I really, I think it was a very good decision for all of us to move forward with the Pearson Testing Center. Any questions?
This is great. Thank you.
Thank you. Well, that's all I wanted to come and share today.
Thank you.
Thank you.
Certainly appreciate seeing you.
Nice to see you as well.
Okay, Mr. Hartman, did you?
It's not on the agenda, but if I can just take a few moments under reports about data after workforce housing, I'll get another item that's of interest of this committee.
What?
I have another item of interest to this committee.
All right.
After workforce housing.
After house, okay.
We actually don't have a report. We did not have a meeting last month. We do have a meeting this month. We are putting the paper together. And
Wonderful.
And you, yes, we're
The white paper.
putting the paper together. We're integrating all the data and information and knowledge that we've acquired. You will be seeing it probably, Pam, in April to this committee? Yeah. So it'll come to this committee first before it goes to the board in April.
All right.
If nobody else gets sick, if nobody else leaves town, you know how that goes.
Pam, did you have anything you wanted to add? Okay, great. Mr. Hartman.
Thank you. And I appreciate just adding one more item under reports. The report yesterday, we had a really good meeting with the representatives from the Pioneer Center on a pilot program they're rolling out called the Urgent Resources Support Program. This is something they're going to start on February 6th. And the intent of this program is to address those newly homeless individuals within our community. When our law enforcement or individuals come in and they see people who are not in the system yet, not in the, our homeless information system. And this program is really intended for like the first-time homeless person after hours. And the intent is to give them opportunities for resources, whether it's, a housing voucher, like for a hotel, or a cash voucher, or something, because they're immediately homeless, they haven't been homeless before, and the intent is to not put them into the shelter, but just to give them an opportunity to get back up on their feet. This is a pilot program, and they have an individual, an urgent resources specialist who is available after hours that law enforcement can call when they find this type of individual. And we're really excited to see how it's going to play out. Once again, the whole intent is to provide, as they call it, a one-day diversion for homeless people. And these are people who, whatever the circumstances, they find themselves on the street, or we just newly found them in the system. And rather than give them a path or put them in a path where they're going to be in the shelters, give them that one day of relief. Maybe that's what they need to get on their feet. So we're really excited about it. We had a great meeting yesterday. We had representatives of the Pioneer Center who are going to be coordinating this. We had Chief Lee, Police Chief of Woodstock. We had our Sheriff's Department representatives in attendance. Shaylin Daigle, to our county coordinator, to roll out this program to our law enforcement communities and to our municipalities. But we're really excited. It's different than the emergency cold weather homeless program that you may have heard about, because Pioneer Center has taken on that responsibility. But it's just like I said, it's a one-day diversion. And what they're seeing and what they're understanding is that's often what people need. When they find themselves, whatever the circumstances, it could be a domestic issue, it could be, you just had a run of bad luck, and they just need that little bit of relief to get on their feet. And so that diversion, so they're not going into the shelter, once they're into the system, then they go through the coordination intake, then they can be aligned with other resources that are available to them. Because the whole point is, people find themselves in the situation down on their luck, they don't know what resources are available to them. And this is just an attempt to kind of get them what they need and then let them kind of build themselves back up. So, when you're at the end, bottom, and there's not a rope to grab onto, they're just giving them a rope to grab onto for that one day. And that's the thing. Now, it's a one-time program, so they get one opportunity for this. But once again, it's a pilot program, so they're
How come they're not here?
Oh, we didn't ask them to be here.
I would like them to come and talk about this, because
so
just for my own, because I think Warp Core just got $300,000 for outreach to unhoused people. And when you say domestic, what do they mean by it?
I mean, the circumstances could be any, that somebody finds themselves homeless.
Unhoused.
Unhoused.
Yeah, so if it's domestic, there's Turning Point.
Well, but once again, but if it's between the hours of.
It doesn't matter, Turning Point is 24 hours a day.
Okay, so this is just to give them.
Okay, I don't mean to be picky.
Right, and it's that one day, and then if that's the resources that they need, then they could be connected with those resources.
Okay, I would like them to come before this.
So let me suggest this, and I think that's fair. They're going to start this program on February 6th. So right now we just have a concept that's putting it together. I would say give them some time to develop the program, let's run it through, if it's needed, then they may have some cases that they can present to you. So
When you say they, who you're talking about?
I'm sorry?
Who the
Pioneer Center.
Pioneer, okay. Okay, just want to.
So we would be happy to talk to them and see if they can come within a couple of months, maybe a report back on how this program's been implemented, how it's working. The intent is that we, as the county law enforcement community Pioneer Center, are going to convene and really ask those questions. How is it working? Can it be tweaked? But it's a pilot program. It's a concept that they've come up with, and we're really excited to see how it goes. Hopefully they never have to use it, but it's available if they do.
What's the name of it again? Urgent Resources?
So the Urgent Resource Support Program, URS.
And so does that mean instead of putting it, if they, it's 9 o'clock at night and would they put them in a hotel for that night? I mean,
They-
and give them resources?
Yes, they would have access to, I mean, there's different vouchers that they could have, whether it's a hotel voucher or a cash voucher, just something. But the 10 is after 10 p.m., 10 to 7,
10.
yeah. And they have a staff that is dedicated to answer the phone when a call comes in. And, yeah, but we had that meeting yesterday, they're rolling it out, and I just wanted to let this committee aware.
So no questions asked?
I'm sorry?
No questions asked?
That's why
It's pretty open.
they're not
There's not a residency requirement. All that's needed is just the name and date of birth, and that's so they can cross-reference to see if they're in the HMIS system, I believe. And if they're in the system, then they wouldn't be eligible for this program. If they're not in the system, they're newly, let's say, unsheltered, then they would be eligible for this program.
So my daughter kicked me out of the house and I had nowhere to go.
Precisely.
Okay. She might
Did
do that. She might.
So,
She's clever.
Well, we'll touch base with them and then find out when a good opportunity to come in and maybe present this program and how it's working.
So we have an extra day this month, which is when our next meeting falls on. Do you think that end of March timeframe
Yeah, we can
would give them enough time to get a feel for?
reach out and ask that question and see if they want to come in. Okay. Thank you.
Thanks, Scott.
Thank you. Okay, I think that'll be a future topic. Were there any others? I know we do have a long list of things already going. All right.
I just wanted to ask Member Ness and Member Althoff, I know that you're working on workforce housing. Would this program be something that you
No.
would even mention as part? No.
I don't think so.
Okay,
No.
okay.
Okay, seeing no reason for executive session, do I have a motion to adjourn?
So moved.
Mr. Shorten, Mr. Hendricks?